I'm Eileen Doherty, and I'm the director of the Colorado Gerontological Society. And we're going to talk briefly today about how to use telehealth for Medicare beneficiaries and some of the benefits that you might be able to take advantage of. So telehealth really refers to the ability of providing healthcare visits remotely. What that really means is that you can use your Zoom or whatever the platform is that the doctor's office is using to be able to have your healthcare delivered. They are doing this in a number of different ways. It can be done by telephone. It can be done with some devices that are set in your home, or it can be done on like a Zoom or a Google Teams or whatever other format that the doctor is using. You can also, if you are using like a virtual platform, if you will, in the sense that you communicate with your physician or your healthcare provider by sending note into their patient portal. You open up an account. You need a new medication, you have a question about something, that also is part of what telehealth is at this point in time. Most of the time when you have a patient portal and you open up an account, you can see such things as your test results. You can see such things as your medical record. So you could view a lot of information. A lot of times you can also see the specialist's reports. So it's a pretty comprehensive, if you will, record of the information that the doctor has in his medical record about your situation. If it's a telehealth visit, basically it doesn't involve any physical assessment, in the sense that the doctor is not going to touch and feel you if there is a lump or a swelling or anything like that. However, what they do is basically they are going to ask you some questions, and they may ask you to zoom in on something. They may ask you to practice something. For example, they may do patient education. So recently I knew an individual who was doing speech therapy over Zoom. So, you know, the first time they provided him with the opportunity to do certain kinds of voice exercises. The second time they had him practice those voice exercises with him. Another activity that they had was blowing, and again, trying to strengthen the muscles in the throat. Other kinds of patient education that can be done is possibly wound care or physical therapy. They also might ask you to do certain kinds of things, like to touch an area of your skin and describe it, or they may ask you certain other kinds of things like, can you take your temperature? Do you have the ability to take your blood pressure? If you have some of those types of devices available in your home. Other kinds of telehealth visits that have been working really well are checking in with people after they have had surgery. This has been really touted as a really big thing, especially for people who have had certain kinds of either surgery or like chemotherapy appointments or infusion therapies, where they're really trying to check in with individuals to see how they are doing. And this avoids having to come into the office. Other kinds of things that they are doing a lot of is monitoring ongoing chronic conditions. So I have a client who has a heart monitor device. She has a pacemaker, and once a month she doesn't even have access to Zoom. She just has a landline. And once a month, they have her hold the receiver of her telephone up to her heart. And then they are able to perform various kinds of tests remotely using the little device, the monitoring device that she has on her kitchen table. Other kinds of things that we've seen in terms of telehealth visits is urgent care situations. So again, trying to either make sure that you, trying to confirm whether or not you have a cold or a virus, and having you provide certain kinds of information that will allow the doctor to make a clinical decision in terms of whether or not they need to prescribe an antibiotic, whether they need to send you to an emergency room or whatever. Other things that they are doing a lot of through telehealth is various kinds of therapy or counseling. Although I've had a number of counselors tell me that they have become more used to being able to do therapy remotely or through telehealth, that the ability to really read body language and some of the other types of things that therapists often will use in terms of guiding the counseling session is not as easy to do via telehealth. Telehealth doesn't always work for certain kinds of conditions. So it's never going to be a substitute, if you will, if the doctor actually needs to check out such chronic conditions as congestive heart failure, where they really do need to listen to your heart. They need to check and make sure your lungs are clear, that other bodily organs are functioning properly. What we are recommending many times in terms of telehealth is that based on the type of condition, if you will, that you are calling your doctor about, find out if doing it via telehealth makes sense, or whether it makes more sense to be able to do it via an in-person visit. Sometimes healthcare providers, especially like the university, are also using a triage system where you provide the information that you are concerned about to the triage line. They then decide whether or not it makes sense to refer you to a telehealth visit, or whether you need to be seen in person, either in an office setting, in an urgent care center, or in an emergency room. The state does put various kinds of restrictions on who can practice telemedicine, how and with whom. Colorado on the Medicaid side has been doing telehealth for a very long time. We especially have been doing telehealth with many of the rural areas, and because we are a very rural state, we have been probably in the forefront in many instances with telehealth type of services. Sometimes there are restrictions in terms of which types of visits can be telehealth. Colorado does allow the first visit to be telehealth if they can verify that you are who you are, and they can also identify your location and some other credentials, as well as if you can provide informed consent to treat. We saw a lot of telehealth being performed during COVID, and it is an ongoing, continuing opportunity. I did start to hear that Medicare is going to be looking at what types of telehealth visits that they will continue to approve, and what types they are going to require in terms of in-person visits. Telehealth also has to be very concerned about HIPAA or confidentiality, which is why if you are using one of the larger healthcare systems like a Centura system, a Kaiser system, the university, what you will find is that they, on their side of the fence, the office manager or whomever has to set up the appointment, because all of those systems are meet the Health Insurance Portability and Accountability Act requirements, meaning that they are HIPAA compliant. So they are so the information is encrypted as it is transferred across the internet in a way to provide that your healthcare information is not shared across the internet and people can hack into it. In general, basically the benefits are that it makes healthcare much more accessible. I have been on a number of phone calls over the last year and a half with COVID, in which the doctors actually have indicated that they really have become used to the ability to do telehealth. They are especially trying to use it for patient care follow-up in terms of being able to just check in with people. And some of the doctors are finding that it's easier to use telehealth than it is to just do a follow-up phone call. Another thing that the doctors like about it is that it cuts down on missed appointments. And so they, again, feel like they're better able to coordinate care. From a patient perspective, obviously the time to travel to the appointment, to park, to walk in, all of those are advantages, in addition to, for some people, the expense. Another thing that is beneficial is that going into the office can expose you to various kinds of infectious diseases. And if you are already compromised based on your current existing healthcare conditions, the less exposure that you have, whether it's to COVID-19 or other kinds of viruses, is also very beneficial. Telehealth is also now, they're doing a number of studies, and they're finding that this also has been a way to reduce emergency and urgent care visits, because again, through either the triage or the ability to be able to talk to either your own doctor or the doctor on call has allowed for some reduction in those kinds of visits. The mental health visits can be effective when they are done remotely. And for some people, being able to do them in the comfort of your home has proven to be very beneficial. Rural patients also have found that telehealth has been helpful in terms of looking at reducing some of the disparities in terms of access to primary care. Rural patients often have to travel long distances to be able to see their physician for specific kinds of care. And sometimes being able to do that again from your home or locally can be very beneficial. So we have a family member, for example, who lives in a rural part of Eastern Oregon, who has suffered for many years with various kinds of cancer and has been able to travel about 40 or 50 miles to a local sort of rural center that has access to his records, and using them as their primary care, he's been able to get a lot of his care out of the University of Washington. And has been able to avoid having to travel 6 or 7 or 8 hours from his home in Eastern Oregon to the University of Washington in Seattle. Similarly, another situation in terms of rural care that we've been able to see is my own mother. So although it didn't have the outcome that we wanted, a couple of years ago, she was experiencing a heart attack and had several on the way to the local hospital. She lived in rural western Kansas. The little local hospital that maybe has 10 or 15 beds, maybe 20, I don't know for sure. Had the nurse practitioner though there. They were able to hook her up to a bunch of heart monitors, which hooked her in then to the local or to the University Medical Center. The local hospital had the medications on hand, and they were able to administer the medications that gave her the ability then to be transported to a major medical center via airlift, and were able to stabilize her and get her at least an initial pacemaker. She didn't survive. She had an additional heart attack after she got to the major medical center, but they were able to transport her successfully. So again, this telehealth is a way to really give rural residents the opportunity to have access to both primary care as well as to specialists. In COVID-19, basically, this is when telehealth has really taken off. One of the things that many people who would not normally have used telehealth have actually taken advantage of it and have learned to use it. And the biggest thing that we have found, if you will, is reducing exposure. It's also given people the opportunity to continue with their health care, even though in some instances, maybe an in-person visit would have been beneficial. We were able to keep people safe and not expose them to COVID-19. So how do you find a telehealth provider? Well, the very first thing that you want to do is check with your current physician. Many of them are already have that available. They may or may not be advertising it because physicians are not necessarily known to advertise the kinds of services that they provide. So give them a call. Another thing that you want to make sure about is whether or not Medicare does in fact cover it. So the usual general rule of thumb is that if Medicare was going to cover this as an inpatient service, meaning you went to the doctor's office, you went as an outpatient, then it will be covered by as a telehealth visit as well. Medicare Part C, which is Medicare Advantage, some of your insurance plans will have access to telehealth visits and will cover them, and some will not. You can also identify Medicare providers at medicare.gov, and basically if you are looking for a provider that provides telehealth services, it gives you a list, and it gives you then the ability to start looking for a physician that may take telehealth visits. If you are scheduled for a telehealth visit, you definitely want to make sure that your wireless connection, whatever your internet is or your telephone system, that it is working. Check out and make sure that your camera or your audio is also working so that you can do a face-to-face with your provider. Recently, I knew a gentleman who thought he knew how to make his camera and speakers and everything work. But then when he tested them, and then a half an hour later, he couldn't get them to work. And so they ended up just doing it on an audio call. So again, the provider was able to make the telehealth visit just using the audio. If you're planning to do a telehealth visit, you may need to upload or send information or call information in to your doctor's office prior to the actual visit. This gives your physician or your healthcare provider the opportunity to review your situation and what your condition is and your symptoms prior to your actual visit and the face-to-face online visit. So some tips for a successful visit: you'll want to make sure that you are in a private and quiet space, that it's comfortable, that you're able to really focus, and that you're not distracted. Again, you want to dress comfortably so that you are able to really have a good visit, and that you're not too hot or too cold, that you're not freezing or shivering or any of those kinds of things. You want to have a pen and notepad available in case your doctor asks you to do something, so you can take notes. And then you also want to make sure that the lighting is good, because sometimes your doctor is going to ask you to show him something, and they'll want to be able to interpret or be able to see that condition. Say it's a bite or a wound, they'll want to see how deep it is, or how wide it is, or how big it is, and they'll want to be able to see that well through the camera. So in terms of Medicare, basically there are three ways that you can have telehealth visits. So a telehealth visit is basically a remote visit where you're using some type of an audio and or video conferencing system. It can be either an outpatient or an office visit. It could be a consultation for an emergency visit, or it can do follow-up. So those are the three primary ways that we're using remote visits at this point in time in terms of telehealth. It could be also a virtual check-in. This oftentimes is basically either a phone or a video type of visit. And this can be done either through a triage team, or it can be done in terms of, okay, we've prescribed these kinds of services. They have started, we're checking back in to see if this has improved the situation, or if you are still experiencing symptoms that we need to address. And then the last type is an e-visit, which basically means that it's a communication using the internal provider portal. And that's the type of thing that I described a few minutes ago. Whereas if you're using like some of the major health systems, they set up the visit and they call you and they send you a link, and then you link into their system. Colorado, or Medicare at this point in time, has what we call 1135 waiver. This has basically expanded access of telehealth under Medicare, so it can now be provided in anyone's home, regardless of where you live. We did for a while have some restrictions about telehealth could only be provided in designated sites or designated areas, but that restriction has now been lifted. It does have to be a visit in real time. So it can't be something that we just made a phone call, left a message, and moved on for Medicare to cover it. We actually have to have an interaction between the patient and the healthcare provider. It doesn't always require an existing relationship between the provider and the patient, but that's a good idea. The virtual check-in is really When will Medicare cover it? Well, mostly what we're looking for is if it is a brief visit to determine if further care is necessary. And what we're really looking for is the existing patient-provider relationship able to determine, if you will, the type of care or follow-up that is necessary. There are a couple of restrictions, if you will, in terms of virtual check-ins, and it has to be related to a follow-up visit that you had within the prior 7 days, or lead to an in-person visit within the prior 24 hours. So again, it can't just be randomly used. It can't be substituted. There has to be a purpose and a reason for it to continue. If we're doing e-visits, basically, we do have to have the established patient-provider relationship. Doesn't really matter where it happens, has to be through the patient portal, and the doctor or the healthcare provider has to basically be able to counsel the patient and talk with the patient, either by them initiating it or you initiating it, or the provider initiating it. Usually Medicare is billed for telehealth under Medicare Part B. For those of you who have attended previous sessions, this is all of the outpatient services. So rarely is a telehealth visit billed under Medicare Part A or your hospital visit. There is some telehealth that is covered for hospice visits that can be done under your Medicare Part A, but those are hospice only. They're usually not the skilled rehab or the home care or the in-hospital or inpatient visits. You do have to pay the 20% copay, or if you are in a Medicare Advantage plan, you would have to pay whatever your out-of-pocket cost is for a patient office visit. And again, one of the things that during COVID, they did pass emergency rules in Medicare to be able to provide the provider with the same amount of reimbursement if they were doing telehealth or if they were seeing patients in person. At Medicare.gov, if you have a Medicare Advantage or a Part C plan, it will, if you review your plan online, it will tell you whether or not telehealth is covered. If you have straight Medicare with a Medicare supplement, the rule is if Medicare pays, then the supplement will pay. They don't have an option to opt out of paying. If you have Medicaid, again, if Medicare pays, usually Medicaid will. If you have only Medicaid in Colorado, Medicaid generally pays for telehealth visits. So this just reconfirms that if you have Part C, basically that you have the ability to verify whether or not the provider will pay for it. So this kind of brings us to the end of the discussion associated with telehealth specifically. If you need any kind of assistance, the Gerontological Society is offering individual counseling. We do have an 800 number, which you can call, or you can call a regular landline. We also have counseling available in Spanish, and that number is 1-855-880-4777. And our 800 number, if you need to call us from out of state and you don't have a Metro Denver number, is 1-866-294-3971. Or our local number is 303-333-3482. We can provide you with individual counseling about Medicare, specifically related to open enrollment or changing any kind of your benefits between now and December 7th. If you need services after that because you're qualifying for Medicare or you have other questions related to your Medicare benefits, you can still call any of those numbers and we're happy to help you. In terms of other kinds of counseling, if you're looking at questions related to a Medicare Advantage plan or a prescription drug, if you're new to Medicare, if you're looking to change plans, we also can help if you are having difficulty paying your Medicare Part B or D premiums. We can help you with counseling you through those processes or assisting you to actually apply for help. If you need help or services with using the Plan Finder for prescription drug support, we can do that as well. So before we sign off at this point in time, I am going to open up the polls. And if you could take a couple of minutes and fill in the polls, that would be helpful. And then I have a couple of other slides. So we'll take a moment and fill out the polls. Okay, thank you all for completing that information. This also helps us with our funding sources to be able to say, let them know who we're serving. So it looks like we've had a large group of people who have come from not only around the state, but also who are between the ages of 60 and 79, and that's been the largest group of people who have been taking advantage of this. And lastly, the other thing I wanted to make you aware of is that the Gerontological Society offers a number of different other programs. We have volunteer opportunities for people if you would like to either have a telephone buddy and have someone call you once or twice a week just to check in and chat, or you could be a telephone buddy and you could call someone. We are always looking for additional people to participate in this program. We have about 130 people who are currently receiving regular calls from about 100 volunteers. We are looking for people who want or need a holiday basket. Our holiday baskets will be delivered on December the 18th, and they are available to individuals primarily in the Metro Denver area. If you either are low income or are going to be alone for the holidays, that's the group that we prioritize for baskets. We're hoping to deliver between 400 and 500. If you want to be a volunteer, we would appreciate that as well. If you're looking at being involved in some advocacy kind of work, we've been doing a lot of work on trying to look at affordable housing for both renters as well as homeowners who are experiencing either homeowners association fee increases or increased taxes. Other services that we can provide is advanced care planning and help with Medicare and Medicaid or benefits counseling. We also have some grants for vision and hearing. Services will buy eyeglasses and hearing aids for people who live in Metro Denver. And we can support dental services, both in Metro Denver as well as at this point in time on the Western Slope if you live south of I-70 and west of I-25.